Hello and welcome. Let's talk about osteosarcoma. Osteogenic sarcoma or osteosarcoma is a highly malignant bone tumor which arises from primitive bone forming cells. It destroys the bone structure and eventually bursts into the surrounding tissue. It may be composed of fibrous tissue, of cartilage, or of mesomatous tissue and begins in the metaphysis. It predominantly affects children or adolescents. This is a picture showing osteosarcoma and this is an X-ray showing osteosarcoma. Now, features. A highly malignant tumor of the bone and usually occurs in second and third decade, and it arises from the metaphyseal ends of the lung bones and 80% metastasizes before the appearance of tumor. Now, pre-malignant conditions of osteosarcoma. Package disease of bone, fibrous dysplasia, multiple exostosis, oncogenic virus, radiation and chemical. Now sites. The tumor begins in the metaphysis and the most common sites are around knee and upper arm, that is lower end of the femur, upper end of the tibia, upper end of the humerus and lower end of the radius. Now clinical features of osteosarcoma. Age. It is commonly found in children between 9 and 16 years and sex. Male is predominant is more than female. Site includes around the knee and upper arm. The gradual onset of the pain and swelling is seen, and the swelling is firm near the end of the bone close to the joint, which is metaphysis, and the overlying skin is warmer than normal and stretched and shiny. The pathological fracture may be seen, and foot drop is seen if common peroneal nerve and anterior tibial nerves are involved. Cough, dyspnea, hemoptysis are seen in case of pulmonary metastasis, and abdominal discomfort and jaundice is seen if liver metastasis occurs. Now, investigations. The plain radiograph of the affected part shows irregular destruction of the metaphysis known as osteolytic lesion, and usually the evidence of the new bone formation under the corners of the raised periosteum known as Codman's triangle is seen, and occasionally well-marked radiating spicules of the new bone are seen within the tumor known as sunray appearance because of the calcium deposition in blood vessel. This is the X-ray showing the osteolytic lesion, Codman's triangle and sunray appearance. Now, in case of chest X-ray, there may be secondary deposit in the lung known as cannonball appearance. Radioisotope scanning can be done, CT scan, MRI and biopsy or open biopsy can be done. Now treatment. Neoadjuvant chemotherapy by methotrexate, doxorubicin, cisplatin and ifosfamide followed by amputation and continuation of the chemotherapy and radiotherapy can be done. The prognosis includes fatal within 2 years and 5 years survival rate is 10 to 15%. Now, sites of amputation in osteosarcoma. If the tumor is on the tibia, amputation through mid-thigh is done. In case of the lower end of the femur, disarticulation of femur is done. If in the upper end of the femur, hind quadrant amputation is done, and in case of the upper end of the humerus, 4 quadrant amputation is done. End of the topic.